Within the programme, the clinical sessions delivering healthcare in the NHS, we're really focusing on how we maintain patient safety for patients that are receiving systemic anti-cancer treatments. We've also got two UCONS sessions that we're running this morning. One is for the UCONS ambassadors, that we're running a workshop activity, and the other is last year UCONS launched a new assessment workbook to assess the competence of nurses giving systemic anti-cancer therapy. We're rolling out at the moment a series of trainer sessions, so we're really delighted to be here at the UK Oncology Forum to be able to deliver one of those sessions this morning to our members. One of the key things is that the professionals that are caring for patients receiving systemic anti-cancer treatments is they've got a really good knowledge of what those treatments are, how they work, and importantly what side effects they get and how those side effects are assessed and managed. So the focus of our session will be covering some of the principles, the biological and pharmacological principles of SACT and side effects they cause, but also how they're managed, how they're assessed. We'll be presenting some case studies about patients who have presented with really quite significant side effects and how they would have been assessed. We'll be talking about our guidelines we've developed to guide health professionals on the assessment of this patient group, and also about how we assess the competence of nurses and other clinicians to safely care for patients receiving SACT. So the main challenge is really about managing patients receiving SACT in the kind of current era of cancer treatment is that it's a very dynamic area of practice. There are new treatments that are being rolled out and licensed all the time and are being introduced to clinical practice, and some of them have quite different pharmacological effects, and so they have different effects on the body and cause a different profile of side effects. So it's really keeping a pace of these new treatments and how we best care for our patients to make sure they're safe. The other real clinical challenge is how we use our highly specialised workforce to the best effect, because the capacity is increasing and the NHS is under increasing sort of stress and strain in terms of meeting the needs of our patients who have cancer diagnosis.